obnoxious.
Today we're going to talk about smoking and just the facts. We're not going to talk about opinions or what people think. We're just strictly going to talk about statistics and what's been proven scientifically. Annually, 440,000 people die. That's actually more than all of the men, women, and children, troops included, that died in World War II. What exactly is it that you are smoking? When you're smoking, you are smoking not just tobacco, you're smoking 599 FDA-approved additives that are in cigarettes. Cigarettes, whenever the FDA approved these additives for food, they were not tested for burn usage. They were only tested for additives that were actually placed into food. About 85% of these additives, when burnt, turn into chemicals that cause cancer. And that's why there's such a high death rate amongst smokers. A few of the additives that are in cigarettes are cadmium, that's used in batteries, butane, it's also used in batteries, and it's also used in lighter fluid. Methane, which is sewer gas. Arsenic is poison. Methanol is in rocket fuel, and ammonia is in cleaners. When you're smoking these, you're basically putting through all these chemicals through your entire body. So when you're doing this, you're causing yourself so many detriments. You have lung cancer, heart disease, lung disease, stroke. It can actually cause infertility as well. And you are just completely ravaging your body. Smoking is the #1 preventative cause of cancer in the United States, or #1 preventative cause of disease, period, in the United States. But it's not just you that you're affecting when you're smoking. Women that smoke while they're pregnant have a higher risk of low birth rates in their children. They have a higher rate of sudden infant death syndrome in their children. Their children also have a tendency to develop cognitive impairments, such as ADHD and lower IQ, behavioral problems and aggression, respiratory problems, which include asthma, bronchitis, any type of infection that would come with a regular season cold can turn into a much worse infection because of the smoke that they've inhaled while they were pregnant and in utero. With children, it actually has been proven that in children of parents that smoke that are exposed daily to secondhand smoke actually have a higher risk of cancer, such as leukemia, throat cancer, larynx cancer, and lung infections, and as well as lung cancer. There are a lot of different ways to be able to quit smoking. It's not an easy route. But it can be done. They have actually proven that with nicotine, it is actually harder to quit smoking cigarettes than it is to quit using heroin. So that just gives you a perspective of the addiction levels that are with smoking cigarettes. To be able to quit smoking, they say that you need to be able to get a support group. Gather people around you that you feel that will be able to support you and bring you up when you feel like you are not able to do that for yourself. You should, if needed, use some type of replacement method like a nicotine patch, the nicotine gum, or the nicotine lozenges that they now offer. Also, there are other methods of quitting that you can use, whether you use just the traditional, I'm just going to stop. If you need emotional support, the CDC does offer emotional support for smokers that are quitting. If you call 1-800-QUIT-NOW, it's 1-800-784-8669, and they can actually send you a ton of information on the different types of ways of quitting and different information to be able to give to you. So basically, in short, smoking ravages your body. It ravages the body of the people that are around you. And when you're smoking around children, you're not giving them a choice. You're taking away their health for your benefit of smoking a cigarette. So I would like all of us to think twice before we smoke in front of our children or in front of other people. And just as a reminder of how many people die because of the effects of smoking every year, during this presentation, at least 4 people have died.